Hello friends, this is Sudharshan, and in this episode we will talk about lens part 2, where we will see the cataract surgeries. So classification of cataract surgeries into two types, extracapsular or intracapsular extraction. So intracapsular extraction is further subdivided into phacoemulsification, conventional method and small incision cataract surgery. So let us see what are the merits and demerits of extracapsular cataract extraction in comparison to small incision cataract surgery or 6. So the merits is it can be done in all the ages and there is a steeper learning curve, and so it is a simple technique. Demerits include long sutures, incisions will be there, post-op complications like the anterior chamber prolapse will be there. Now let us go into the procedure. So a very short procedure. First thing, we will be doing anterior capsulotomy via can openers technique. Then we do the removal of the anterior capsule with continuous curvilinear capsulorhexis. Then we take out the nucleus of the lens. Then we aspirate the cortex out, insert the haptics, superior and inferior haptics, and then IOL dialing happens and corneoscleral suturing will be completed. Next, coming on to intracapsular cataract extraction, let us see the conventional method, how it is done. Right, so this is the first thing we have is the superior rectus bridle suture, then partial thickness groove, then fornix based conjunctival flap, then corneoscleral incision, then peripheral iridotomy is done. Then after that the lens is extracted as a whole and then an artificial lens is placed and corneoscleral suturing is done. Now coming to small incision cataract surgery, let us see first the merits and demerits. So the merits as such, it is done in all cataract types and it is most effective, cost effective than phaco, and it is a closed surgery. And when it comes to the demerits, steeper learning curve, conjunctival congestion and mild scleral tenderness. Now let us see the procedure of small incision cataract surgery. Now, so first we have the superior rectus bridle suture, then after that we have the partial thickness incision along with the conjunctival flap, then after that corneoscleral tunnel is made, then after that there is a side port entry, and once the side port entry is there will be hydrodissection and hydrodelination. Then continuous curvilinear capsulorhexis or triple C will be done. Then after that the lens will be extracted as such, and then the cortex will be aspirated out. Then the inferior and superior haptic is inserted, the IOL will be dialed inside and the corneoscleral suturing will be complete. And when it comes to the last but not the least, phacoemulsification. So the merits and demerits. Merits is topical anesthesia is given, small incision is there, corneal scleral complications are less, and recovery is faster. So demerits, we have a steeper learning curve, it will be expensive and it is not suitable for hard cataracts. And finally the procedure of phacoemulsification. So a very short procedure. First thing, side port entry is done, then corneoscleral tunnel along with partial thickness groove and conjunctival flap is prepared, then hydrodissection and hydrodelination is done. Then after that we have the aspiration of the cortex, and after that a foldable IOL will be injected into the eyeball. So this is all about the intracapsular cataract extraction and phacoemulsification, and this is all about the various surgical procedures which are done in cataract. So that is all about the chapter of lens. So thank you so much. We will see in the next lesson.